In the Ghanaian society, it is not very common to find people pay visits to the hospital unless they are sick. This is often blamed on affordability, limited access to healthcare services or facilities, or a lack of knowledge about the importance of medical checkups.
We in Ghana have to always go for checkups because Ghanaian will only go to hospital when he's dying or something happened to him. It's, oh, he wasn't sick, or the grandmother or my mother is a witch, and that's why the person died.
It's just like a norm. You get sick, you go to the hospital, as we always experience here. So I don't just wake up and then go to the hospital to check up. Unless there is, let's say, you want to use it for something. You want to travel or you want to go to school, then they request for it that, oh, go and check, go and do tests and then bring it. Aside that, I don't.
But health practitioners say this attitude is not the best, as it often compounds ailments or conditions that have deteriorated over a period due to the neglect or lack of self-awareness.
A lot of people, that's why you have a lot of obituary, and the caption there is, what a shock. It's no shock because we don't check. I mean, the typical Ghanaian will not go for routine checkup.
Preventive services refer to checkups, patient counseling, and screening to prevent illness, disease, and other health-related problems. On the streets of Accra, I engaged people at random to find out what they know about preventive health care.
Checkups, it's poor. Usually we go to hospitals when we are about dying, and we don't do the checkups often as we should, at least twice a year or once. It's acquireable. It's okay for we to do the checkup, but we don't do it, and we wait for the sickness to dawn on us or to cripple us before we walk to the hospital. Thereby we are fond of choking the hospitals.
I think it's important. Well, when I went, the doctor said every 6 months it's very important to do that, because if anything is growing, like the cancer cells and whatever, they can detect it earlier and then help you. I think Ghanaians, I don't know, we have this idea that we are always going to live till we are older. I think I get this notion. I'm not the only one, no? Right. Everybody thinks that we are always healthy, but there are a lot of people that are going around with medication and they have to take it every single day. They can't live without it. So I think more education needs to be done on that. I don't know how that's going to happen, but it's important.
Usually, people cite the lack of money as the main reason for not visiting the hospital until there is an immediate need to. But preventive healthcare, when practiced regularly, rather saves money, as it helps to reduce the cost of healthcare if the problem is detected early. It is for this reason that the Ghana Municipal Hospital has set up a wellness center to cater for the needs of people within the area and its environs.
And so this service of wellness is to offer the average Ghanaian or every Ghanaian the opportunity to walk in, come and check your vital statistics or vitals. When I mention vital, I mean your blood pressure, your pulse. You can check your sugar, you can check your weight and your height, and we can calculate your body mass index for you, and I counsel you if you need any advice concerning your weight, concerning your diet, and even concerning mental issues. It can be done. So we appeal to our clients and the community, surrounding community, to patronize the wellness clinic. You don't need to pay for anything. The only thing probably that you may pay is when you are checking your sugar. Of course, it involves money. We need to buy the strips, so you may pay something small.
As the popular saying goes, prevention is always better than cure. Why don't you pay a visit to your doctor today while you feel healthy? Reporting for Citi News, I am Na Adole Morfight.